This is Selma Schimmel at the 2012 Multidisciplinary Symposium in Thoracic Oncology happening in Chicago. This meeting is presented by ASTRO, IASLC, and ASCO, as well as the University of Chicago. And now we're bringing you our Advocacy in Action feature.
I think the advocates play a major role in taking the message from meetings such as this into the patient's community, into the care provider arena.
I think lung cancer is a disease that's crying out for greater advocacy.
One of the problems with lung cancer, unfortunately, has been the fact there are relatively few survivors. So there have been relatively few patients to advocate for lung cancer. And so one of the major problems that we have had is getting word out there. And getting word out there for more research, getting word out there that there are better treatments, making people aware of all the research and all the progress we have made.
We could learn from our colleagues in breast cancer. Breast cancer has evolved into a very powerful advocacy movement that has really changed the way the disease is viewed and the way the disease is supported and resourced in terms of a national priority, in terms of research and trying to improve clinical outcomes. Lung cancer has not yet benefited from that same degree of enthusiasm.
I think there's a couple of key messages that advocates and just the public in general should know about lung cancer. One is what a big problem it is, because people for a variety of reasons don't talk about lung cancer, and they don't realize what a big problem it is, how it can affect anyone, regardless of their gender, regardless of their smoking history, regardless of their age, and how many advances have come together in the last couple of years in lung cancer. I think it's important for people to realize that that has been done on minimal funding. Lung cancer is often underfunded compared to some other cancers. And I think that it's very important for patients who are newly diagnosed with lung cancer to understand that almost no matter what their specific situation is, they should have their tumor genotyped.
As far as radiation oncology is concerned, I think that advocacy is tremendously important, because as the discipline in the field of cancer management is moving more and more towards minimally invasive approaches. That is, the idea and the understanding that we need to not only be focused on how we're going to treat the disease, but how to minimize the negative impact on our patients. Radiation has a larger and larger role to play, because it is the poster child for a non-invasive therapeutic approach. And if we use it right, it can be a tremendously powerful weapon to eradicate the disease. And that can only move forward, and advancements can only come if we have strong advocacy support along the way for the field. And this field is a small field, and so I think that it's really in need of that kind of support, and groups like yours are ones that help lead the way on this.
How much work needs to be done in the area of patient education to help patients understand the role they have in ensuring proper tissue collection, which is a challenge in lung cancer?
I think that there's quite a bit of work that we can do. I'll give you an example of a patient who was not offered tissue testing and was told, okay, well, I'm going to just put you on chemotherapy. But the patient did their homework. They went online, they read up on things, and they learned of the advances that have been made in understanding these very specific changes in tumors. And they got a second opinion. And they wound up getting their tumor tested, and it just so happened that they had one of these mutations that we do have a drug to treat. And so then they went on, and it was actually, they were going on the clinical trial at the time. The drug has since been approved. But they went on that clinical trial, and they're still alive today. And so I think patients have that kind of power to understand what are their options, what opportunities are there out there, that even if it's not offered by the physician, then they can go and take the next steps, get that second opinion, and go forward and help themselves have the very best possible care.
And I think there's also a lot of power in one's ability not only to help themselves, but knowing that their tissue could actually benefit the research and the study of their disease type that would help a lot of people, thereby bringing meaning to one's own cancer experience?
There's no question. People invariably with cancer, if there's something that can be done to be helpful to others out of their situation, they want to do it if they can. If they're physically able to do it, if it's not too much of an imposition to them, they absolutely want to do that because they're saying, this is crappy what happened to me, and I don't want it to happen to anybody else. I don't want anybody else to have a crappy situation. Please take my tissue, do what you need to do with it to make things better.
So what would your vision be to unify advocates?
I think that among the advocate community, there is a global recognition of the importance of this. I think it comes down to the resources of any individual advocate or any individual organization and a decision on their part as to kind of what they're going to champion and the flag that they're going to bear. So I think that the challenge is to have everybody see this issue on the same level of importance as others, and that may or may not happen. But I do think keeping the lines of communication open between organizations and among organizations to ensure that everyone recognizes the importance of the issue, even if they don't have the resources, whether it's time or financial or what have you, to raise the flag on the issue, but that they know what the issue is and that they are able to promote the need and for education when it comes up.
I think forums like Vital Options are great mediums for like organizations to get together and share information and discuss common challenges as well as common successes and where they can work together. Obviously, organizations have different philosophies and they have different foci, but at the end of the day, I think we're all here to benefit patients, and the information that's available and the vastness of the lung cancer marketplace in terms of the patients that are affected by it, I think there's room for all of us, but certainly there's also room for collaboration, and as an organization we try to do that wherever we think we can.